Welcome back to 3+U. Well, let's welcome in one of our more fun guests that we have. He's got a great personality, and we love talking to him. His name is Shawn Jones with Chattanooga Wellness Natural Health Center, location in Chattanooga, location in Cleveland. And it's, you know, and it's not just chiropractic. You are like a health, all total health for the body. That's kind of what you do, isn't it, Shawn?
Yes, hey, great to see you again, David. Yeah, at Chattanooga Wellness Centers, we do a lot more than just chiropractic care. I'm a doctor of chiropractic, but we also do a lot of wellness services. In fact, let me show you what a detox foot bath looked like at the beginning. Go ahead and tell that over here. 2 hands, pick it up, and show it right there. See that? That is a detox foot bath. We're going to turn it on and start it. And at the end of the segment, you can go ahead and set it down. Show my pretty face again. We're going to see what it looks like afterwards.
Nice.
I don't know if the fans saw it, and people see it, but we also have a laser on her to help open up the toxins too. Sometimes we put a laser on the patient while we're doing a detox foot bath. Now, detox foot baths, what they do is they pull heavy metals and chemicals out of the surface capillaries, passing through whatever part of your body you put in the foot bath. We usually use the feet because it's convenient. And then it's also going to pull some B and C vitamins out, so when she's finished, she'll take a multivitamin to put the B and C vitamins back in the body, but leave the heavy metals and chemicals out of the body. And it's a great way to detoxify the body safely and very, very effectively.
All right, so Shawn, real quick, you also do, and we're going to take a look at the actual foot bath here at the end of the segment and see what the result is, but let's talk about some of the other things you do. Specifically, you do muscle testing, nutritional response testing. Let's start with muscle testing. What are we testing, and what are we looking for with that?
Well, with muscle testing, it's a binary system of communication. It's called Applied Kinesiology. And what that means is it started by George Goodhart, who's now deceased, but what George did, he discovered how you can ask the body questions. A binary system of communication means we get a yes or a no with muscle testing. Hey, Carrie, step over here a second. Let me test you. Come on over here. This is Carrie, one of my assistants, who manages the office here. When you test a muscle, hold this up, like your arm, hold hard. So we get a test there, and what we do is want to check, ask the body something. This just means we're in sync. Good. And then hold hard. And what I'll do is I'll challenge the body. This thing's called blocking and switching. When I stretch my hand, it creates an electromagnetic field. And her belly button, her ear, hold hard. And her mouth doesn't do it. So she's what we call blocked.
Okay.
And the stimulus. So what we do with muscle testing, we ask the bodies a series of questions. And when we find things like blocking, we got to open up the block regulation. Let me explain that. You have your autonomic nervous system. You have your sympathetics and your parasympathetics. Sympathetics is stress, fight or flight syndrome. Parasympathetic means the opposite. It means relaxation. In charge of sleep, bowel control, bladder control, and all those other functions in the bedroom are all parasympathetic functions. So in the morning, we should go into sympathetic drive, wake up and take on the day. At nighttime, we should do our parasympathetic drive. And one of the biggest things we test for with nutrition testing is omega-3 fatty acids. So when we take omega-3 fatty acids and put them on there, there it is, DHA, EPA. We hold this up, hold hard, and that opens up the regulation. That's the body telling me that that's going to help the body to heal. Now, here's the nice thing about pharmaceutical-grade fish oils, David, is when you take your fish oil, it kicks up your parasympathetic nervous system. So when should people take their omega-3 fatty acids? At nighttime, right?
That's when I take it, yeah.
Yeah, if you take it all in the morning, it's going to help you relax in the morning, but at nighttime, if you're not sleeping good, we've been able to help patients get off Ambien and other drugs, and I can't take anybody off of medication, but most EMDs tell them don't take it if you don't need it because it can be addictive and stuff. So what we do is with omega-3 fatty acids, pharmaceutical grade, when you take it before bed, about 45 minutes before you want to go to sleep, it upregulates your parasympathetic and you sleep like a baby.
That is awesome. Yeah, and Shawn, let me tell you real quick, that's hitting home with me a little bit because, I don't know if this is an age thing, but I've noticed as I've gotten older, it's a little harder to sleep sometimes. So just that little tweak could help out a little bit, right?
Now, I want to stress, everything we carry in our offices are pharmaceutical grade. That means it's 99.9% pure. There's no mercury or dioxin in the fish oil. Don't buy it just anywhere. It's got to make sure it's pharmaceutical grade, which normally costs $200 at a pharmacy because pharmacies charge a lot of money, or pharmaceutical companies, not the pharmacies. However, ours is only $25.50 for tuna oil, and it upregulates your parasympathetic nervous system, and you sleep good, and you don't have to take a drug, and it also feeds your heart. Remember, your heart only burns fat. So what we need to get in here and find out what it is and fix it so your bowels are moving properly so you can get the toxins out of your body by normal bowel movements and through a detox foot bath, like we're talking about and showing you today.
Okay, so Shawn, and we're going to take a look at, and I don't want to go to it yet, but has the foot bath had enough time?
No. Well, it takes
Okay.
about 10 minutes.
So I want you to go, and this isn't on our talking points thing, but I want to hit it because chiropractic care I'm a huge fan of. I kind of like anything non-traditional, any kind of medicine or treatment that works. I'm all about it. Chiropractic care helps out with a lot of things. For me specifically, I was having migraine headaches, had one adjustment, and that pretty much took care. I don't get migraine headaches anymore, and I just go get a periodic adjustment. Talk about some of the things that chiropractic care can help.
Well, one of the things that I do with chiropractic care is I deliver a great adjustment just like other chiropractors in town do also. I went to Palmer College, that's the oldest, largest, best school in the world, and I've been doing this for a lot of years. I'm getting to be an old fart in town here. And I'll tell you something, David, what I do is I muscle test for the adjustment. My dad, when I first got to school, I took him to different chiropractors, and finally I took him to one that laid him down, muscle tested him, and knew exactly what to adjust, knew if he corrected it or didn't correct it, because the muscle came back strong. And then I'll use a little pocket laser like this, a little 3-watt laser, and I will go in and reset a weak muscle. And all I have to do, Terry, step over here just a second. And all I have to do is, when a muscle's weak, hold hard. Okay, like this deltoid is a little bit weak. Reach up and touch the nerve going to the deltoid muscle. When she does that, she's taking electricity from her hand, put it right in that nerve root, hold hard, and it makes it strong. So all I have to do, this isn't, brain surgery here, I have to go take my laser, and I turn it on, just like that. It takes 3 or 4 seconds. Hold this up, hold hard, and boom, it resets the nerve, it makes the muscle strong. So when I adjust somebody, if your shoulder or your hip or your ankle is bothering you, I test all the muscles around that joint, and the ones that are weak, I reset them just like that, so you're stronger before you leave. It doesn't take 12 weeks of physical therapy to bring the strength back. I can do it with a laser in 2 or 3 seconds.
So Shawn, is the key basically to do the muscle testing first and then the appropriate chiropractic care for the muscle testing?
Well, no, actually I do it as I go through. What I do is I clear the spine because 80% of weaknesses will go away once I adjust the spine. But when they're having difficulty with bursitis in the hip or neuropathy, we have a lot of patients come with neuropathy for treatment. And what we do is we check all the muscles, like the big toe test. If your big toe is weak, that's your 5th lumbar nerve. If I adjust your 5th lumbar nerve and it's still weak, all I have to do is take a laser, reset the 5th lumbar, and now it's strong again, and we move on. If they've got better strength so they don't have falls. Now, can I say something about neuropathy for just a second?
Yeah, absolutely.
Let me tell you something, David, and this just came out, you probably saw this working with media, is the CDC finally came out and said the actual number of deaths related directly to COVID is less than 10,000, not 180,000 or anything. It's less than 10,000 deaths. That means that it's less than 0.03% of the people that get it die. And 80% of those were in nursing homes. And half of those were because of coma in New York. I won't get into that. So here's the point. If you've been hesitating coming in for neuropathy treatment, please, by all means, get in to see us. We have the best neuropathy program with a 99% success rate. If you go through our program, you want to go through it.
And Shawn, hey, real quick, we have about 30 seconds left, so I want to see the foot bath.
Okay, you want to see the foot bath? Here we go. It hasn't been quite enough time. Go ahead and show it like this. Bend it over. And all the way down. There we go. So right now, you see there's some browns coming out. You see all the bubbles coming out here? That is toxins coming out. She needs about another 7 or 8 minutes still, and it'll be brown. I sent some before and after pictures to you guys.
Yeah, that's appropriately.
By the way, we have a special on foot baths. It's only $50 for 2. You come in and get 2 detox foot baths for only $50 at either of our locations in Chattanooga by the airport or in Cleveland right by Chattanooga Hospital.
Shawn, you're awesome, man, and that was appropriately gross. It was. The water was supposed to be gross, and it in fact was. So,
it's $99 for 2 visits, includes your exam and everything.
You got it. Shawn, thank you so much. We're going to take a quick break. You see the 2 locations right there. Also, go to nutritiontesting.com, nutritiontesting.com for more information on that. We're back right after this. 3 Plus U continues.
Thanks, David.